So as we're gearing up towards the second annual Youth Voices Summit, the last critical thing that we needed to do today is to just share with you what you should expect in the different thematic areas. So the first thematic area, we're talking about the place, leadership and governance, the place of the youth towards the realization of UHC. One of the key things that we've had over time is the discussion on young people as the leaders of tomorrow, the future leaders, as all that has been said. The question is, are we the leaders of the future, or are we the leaders of the day? Because we have potential to deliver solutions now, but we also have potential to keep delivering these solutions sustainably into the future. So when we talk about leadership and governance in towards the realization of UHC and focusing on the place of the youth, then the one key thing that we have to acknowledge is that one, leadership sets the direction. Leadership determines what particular priorities do we have, how do we invest, and how do we deliver on them. That is critical for us in ensuring that we achieve universal healthcare coverage. And just on the principle of UHC is to ensure that there's reliable access to effective quality healthcare services and products to individuals who need them, when and where they need them, without suffering financial hardship. So the leadership sets direction on what that means. And therefore, as young people, we're definitely going to be key as service providers and service users. We are the consumers, and we are the same service providers when we're working in the healthcare system as young people, and we are the majority in terms of population generally across the world and across the African continent and Kenya, to be specific. So on that account, then we need to ask ourselves, what are we doing to ensure that leadership and governance is anchored on our needs and actually responsive to the needs? So that is a critical bit that we need to look at how we're going to discuss it. And in my perspective as an individual is the fact that one, we need to shape the discourse from policy and advocacy measures, and we need to see what are we doing and how can we do it better. Then two, beyond advocacy and actually asking for what needs to happen, we have influence in the respective organizations that we're working on as youth leaders in the respective institutes. Then are we taking the leadership, and is our leadership ethically and morally guided to ensure that we achieve our mission? And if we're able to do that, then that would be a success for us. And I think if we adopt that kind of level of leadership, that is level-headed focus on setting strategies and priorities right from the start and investing in making that a reality, then we'll be on the trajectory to ensure we have reliable and effective healthcare services and health systems from a leadership and governance perspective. The other bit is also ask ourselves, leaders, young people as the leaders of tomorrow, as leaders of the future, is to ensure that how are we then positioning ourselves to understand the dynamics? And that is a critical bit that we're going to discuss. How do you position yourself? How do you learn from what has been happening? And how do you take those learnings to inform your next intervention? Because we believe by having you informed and enlightened, then you're able to have a sustainable future in our healthcare systems. So leadership and governance towards the realization of UHC, the place of the youth is about what you're doing now and what you can do in the future based on what kind of support you need to be able to achieve that. So I urge you to join us for the Youth Voices Summit from 1st to 3rd of December. Amref International University is the location. Feel free to engage and reach out to us at Africa Agriculture, Health and Social Innovation as much as you want to, and we'll be glad to work with you towards this journey. Thank you so much.